Your doctor has recommended that you have arthroscopic surgery in order to repair a torn meniscus in your knee. But what does that actually mean? The knee is one of the most important and one of the most complex joints in your body. It is made up of bone, ligament, and cartilage. Damage to any individual part can dramatically restrict the normal movement of the leg and can even interfere with the ability to walk. Let's take a look at the way the knee is put together. The femur, or thigh bone, meets the tibia to create a flexible joint called the knee. Helping to stabilize the knee are flexible bands of tissue called ligaments. Protecting the bony surfaces that rub together are pads of tissue called cartilage. Cartilage acts like a cushion. Without it, every time you bend at the knee, you would cause the major bones of the leg to grind together. The meniscus is cartilage that not only protects the bone, but also acts like the leg's shock absorber. Twisting or bending the knee during sports or even normal activity can damage the meniscus. Symptoms include swelling, restricted movement, pain, and even the inability to stand on the affected leg. Surgical procedures performed by making an incision large enough to expose the entire operative area are called open procedures. Your doctor believes that your medical condition and overall state of health make you a good candidate for less intrusive arthroscopic surgery. An arthroscope is essentially a very small video camera that your doctor will use to guide the surgery. Using an arthroscope, the surgeon is able to operate by making one or more very small incisions, through which the sterile arthroscope and possibly other instruments are inserted into the body. However, it is important to understand that during the procedure, your surgical team is always prepared to convert an arthroscopic procedure to an open procedure, should they feel that your condition requires a more direct approach. If the surgical team makes this decision, you will find upon waking up that your doctor has made a larger incision and that healing may proceed more slowly. Converting to an open procedure will affect the length of your recovery and will probably require hospitalization. Of course, no surgery is completely risk-free, but your physician believes that if you decide not to undergo the recommended procedure, you may be putting your health at risk. Before your doctor can insert the arthroscope, the surgical team will inject a clear fluid into the joint. This fluid will inflate the interior space and will help your doctor by providing an unobstructed view. Once in place, the arthroscope will provide video images so the surgeon can insert the instruments through one or more small openings. After inspecting the extent of the damage to the meniscus, your doctor will repair the meniscus with tiny staples or remove it altogether. Finally, all the instruments are withdrawn and the clear fluid is allowed to drain from the knee. Following surgery, sterile dressings are applied. To aid in healing, your knee may be stabilized with a brace, and you will be encouraged to use crutches during the recovery process.